up, guys? We got Clint in the house today. Clint works as a writer, and how many hours a week are you writing?
Anywhere from 40 to 60 generally.
All on the computer?
Yes.
40 to 60 hours a week on the computer, typing continuously throughout the day, doing some research and reading a little bit as well, I think, and organization of words and sentences and paragraphs. Clint came in with pretty severe neck pain, upper back pain, right?
Yes.
And difficulty turning head?
Yes.
Yes. And how's the pain been? I think this is your 4th or 5th appointment.
It's definitely reduced.
Definitely reduced.
Getting better.
So before we get into treatment, let's just look, Clint, scooch forward for me, and then do your stretch that we've been working on. You guys, you'll see this in all our videos today because this is one of my most powerful exercises. Clint works on a computer. He's got really chronic tight neck tension and upper back tension. And right now we're working on, and he's doing this beautifully throughout the day, pressing his palms down, sitting up nice and tall, lift your head up high, and squeeze the shoulder blades back. So we've been really working on just, do you feel how that activates back here? How tight is everything? It's pretty tight, right?
Yeah.
Yeah. So when we do the shoulder and thoracic, the glenohumeral joint, the thoracic extension, he's working on stretching a lot of the muscles down into the arms. Wrists feel tight, right? Yes. Forearms feel tight. So you guys will see we're going to do a little forearm treatment for the flexors down in the elbows today to help improve some circulation down into his arm. But we've recommended on Clint's first appointment that he starts periodically throughout the day, hopefully at least once every hour, to kind of just sit and stretch a little bit, take a little bit of a computer break. As he does this, he's getting mega muscle activation in the arms, mega flexibility down into the wrist. It's really helping to turn off or reduce the chronic tightness up in his neck that he's had developed. All right, you can take a break from it. And then let's just sit up nice and tall like that. Cool. So we're going to work today with the hypervolt, up around the upper shoulder muscles. And you guys will see a little bit of muscle work up in Clint's neck. We're going to do some finger adjustments, some wrist adjustments, a little bit of soft tissue treatment to the arms, the forearms. And we're going to try to get Clint adjusted a little bit better today than his last appointment. I think we're just seeing you once a week, right?
Yes.
So he's in what we call more of an active treatment plan, where we follow up a little more frequently than some of our other patients who we reduce to maintenance care. And there's really 2 tracks of care that we go through. The active plan, when you start off as a new patient, you have no idea what kind of stretches or exercises to work on. We talk a lot about his daily job duties. We've learned that he sits at a computer 40 to 60 hours a week. His work is extremely strenuous. He's putting in tons of hours every day, typing and sitting in poor repetitive posture, which we are starting to break that habit with exercise guidance as well as treatment, right? So the treatment includes muscle work to the upper shoulder muscles, which we do on almost every patient that comes in here. And then we're going to work on the suboccipital muscles, some of the neck extensor muscles, the lateral neck muscles where we get really tight and compressed up into. And then we're going to guide him through the appointment on different body positions that will help to eliminate his pain as he works at home to take a little break throughout the day and start to include some correct stretching throughout his work day. Not only is the stretching and the at-home work going to help to reduce and improve his reduce pain and improve his adjustments here in the office, but it'll help him to learn how to be a little proactive in his self-care at home, right? And self-care is super important. We try to get all of our patients to not be dependent on my treatments, the adjustments of the muscle work. The more that we teach this guy how to do some at-home postural activity, postural exercise, the better he's going to feel, the less pain he's going to be in, and the less he has to come in here, which is awesome because he's busy as heck. He's got 2 boys at home. And so taking 30 to 60 minutes out of his day to swing by here to the office, probably sometimes a little stressful, right?
Sometimes, yeah. Reschedule appointments a few times.
Reschedule appointments. And so, here in the office, we're not mega strict on keeping your appointments. If you need to cancel, that's fine. But, just realize you have a little more at-home work to do. Definitely focus. If you do need to cancel an appointment, when you make that phone call, say, all right, I'm going to do double my stretching today to help better my body and benefit my neck pain and benefit my upper back pain. Look straight down for me. Try to sit up just a little taller. Perfect. So the Hypervolt is a vibration or a percussion device, and it's really great because it helps improve circulation. It reduces some of the muscle tension. He will instantly feel a little lighter as he walks out of here. And we're going to help coax him back into a better postural habit so that, again, his neck pain decreases. Started out pretty severe, right?
It did, yeah.
And it's how much better? 30, 40, 50%?
Probably somewhere about 60, 65%.
65%. Now this is I think it's his 5th appointment in here over the past probably 6 or 7 weeks. So not a ton of time. A lot of chiropractors that are more passive based, they don't teach exercises, they're gonna make you come in 2 to 3 times a week. We don't need to do that here. As long as we get you educated on a couple exercises on the first appointment, we kind of reiterate those exercises each appointment after to make sure that you're doing them. The more that you do them, the better you will feel at a quicker pace. All right. Look down for me. And I usually start with the patients facing down, just looking down a little bit. It helps me to kind of scan the suboccipital region as well as the full cervical spinal column. And just kind of feel where we have any majorly like jammed up spots, tight spots. Look left now. And then head up. And now head down gently. And now head up. And head down gently. And when we make him look up and down, we're shortening the muscles and then we're gently elongating the muscles. Look up, look down for me. And that's allowing us to get a nice full range of motion through the cervical spine, allowing us to really hit all the fibers of the extensor muscles. Look down for me. Look up, look down, look up. Down for me. Good work, buddy. Look up and look down for me. Look up, look down for me. All right, take a break right there. We're going to switch gears over to the left side. How many years have you worked as a writer?
21, 22.
21, 22 years. Started off on a computer, or?
I did, yeah.
Yeah, awesome. And any activity over the past years, like outside activity, physical fitness, exercise, or not too much?
Yard work, which is pushing a lawnmower around the yard, and we build things, decks, treehouse, things like that around the house, garden, enclosures.
Lots of work, lots of yard work.
Yeah, and then we do periodically go kayaking and go biking.
Nice.
Haven't done much hiking in the last year or 2 years, but
Yeah, kind of a little crazy though, right?
yeah.
Sit up tall. Now his boys are getting older. Now he's got baseball or soccer primarily, right?
Soccer, yeah.
And so running from work to soccer games. All right. Now, right there. Hold right there for me. We're going to do one more series on the left shoulder. And I believe we started off, was left side neck pain worse than right?
Yeah, left side was where it was really sore. The right side was just tight.
Yeah. And so what we feel on the left side of his neck is a little more muscle spasm and irritation. Feel right through there a little bit there. How sore?
When you push on it, it's talking to me.
It's talking to you, yeah. Now there's two kinds of pain that we like to evaluate. One of them is like what I call active pain. So if we're not touching you and you just come in here with neck pain, that's active pain. You can also have kind of like latent or passive pain. His active neck pain has decreased, but we can still palpate or press on muscles throughout the spine that elicit a pain response. And those are the muscles that are still a little just irritated, overactive or underactive, a little tenser than what we want. And so those are going to be the guys that we really focus on. We just feel these little pressure points, these little fibrous adhesions that cause cervical vertebrae compression. The longer that things are compressed, the more at risk we are for disc herniations or worsening spinal conditions. Good. Okay. Good work, man. And so developing good posture, good shoulders back, nice head up high, will help us long term. As he holds his body right here, he's softening up his upper trapezius muscles a little bit, and he's starting to just activate some of these mid-back muscles. All right. And stop. And push. And stop. And push one more time. And stop. And last time, push. And stop. Good work. All right. Left leg up. And push. And stop. And push. And stop. And what we do with this exercise, guys, push and stop, is push, a little knee flexion, and it's a good little pump for the lower extremity. Push one more time and stop. Helps loosen him up a little bit throughout the day. Push and stop. We're straining and activating his quads and his hip flexors a little bit with some resistance. And that's going to help us in the lower body to just keep things in line. He's not in here with low back pain, chronic low back pain or hip pain. I'm sure he probably has some periods of soreness in the low back, but yeah, a little bit on this right side. His right side is his little stickier side. His left hip stretches just a little bit. Is there any pain on the left side?
Yeah, actually, right now my left hip is a bit sore.
Talking to you a little bit?
Yeah.
How about over here on the right?
Just when you push.
Okay. So I'm going to raise your shirt up. We are going to do a little muscle work down here today, okay? And then, guys, what we do in the low back, which you've seen in other videos as well, is some myofascial release to some of the erector muscles. We've been working primarily on Clint's upper body, his thoracic extension, his CT junction. So we want to kind of flatten this area down just a little bit. We want to improve his ability to extend and help loosen up and improve the range of motion throughout the vertebrae, to help improve circulation, pain reduction, eliminate muscle tension and spasm as we work on balancing out the structure of his body, and we get him educated on some of those at-home exercises. A little bit more on the left side, okay? Feel like I read in there?
Mm-hmm.
All right. Take a deep breath in and exhale out. Nice. Deep breath in and exhale out. And exhale out. Perfect. Deep inhale and deep exhale. Okay, good work, buddy. All right, stay right there. All right, guys, so that was some low back treatment. Now we will, you okay?
Where your left hand is sore.
Sore? All right. So let's do a little hypervolt around the mid back as well. Come like right in there a little bit here. All right. So since we started including the hypervolting with our treatments, reduces some of the time that we get the hands, that we have to use the hands on the patient. It also allows us to treat a little bit more over the clothes. In the office, we primarily focus a lot of our muscle work up into the neck, the upper back, and then down into the lower back, and anything through the mid back. Sometimes if the patients are wearing appropriate clothing that's open, we'll be able to get through this area a little easier. For Clint's sake today, we're going to just use the hypervolt over the thoracic spine. And you may get some cramping, buddy. Is that what you're getting?
Yeah.
Okay. So when Clint lays down on his stomach on these chiropractic tables, it allows him to kind of flatten his whole body down onto the ground. Now, when your spine's a little crooked or twisted, you have muscles that are tighter on some sides, on one side. So we might have a little muscle that's tight through the intercostal region or the rib region, and then the opposite side can get weak. So he may feel as he lays down here that he gets some muscles that kind of cramp up or seize up a little bit. A muscle that cramps is what we call an inhibited muscle, and that's a muscle that needs to be strengthened. It needs to be neurologically activated. So you guys will see how he's kind of pulling his left shoulder back. Do you feel that? Is it cramping in there?
It's easing up now, but
Yeah, okay.
it's cramping pretty good.
Yeah. So when you lay down in this position, it helps straighten your body out, straighten your rib cage out. And these muscles up here, some of the intercostal muscles, maybe the rhomboids, are getting a little bit of activity, a little bit of neurological activity. All right, let's take a deep breath in and exhale out. Whole way down. One more. Good. Breath in and exhale out. Whole way down. Good. All right. Breath in. One more. And exhale out. Whole way down for you. All right, buddy. Hey, man, that was mid-back adjustment. Big time compared to where we've been the past couple weeks. One more time. Inhale. Exhale out. Whole way down for me. Good. All right. Okay. Let's face over to the right side up for me. One or two of these in the past. You okay?
This is cramping.
Okay. Just stick through right here with me. Exhale out. Roll to me. Up, 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 up. I got you, I got you. Breath in. And exhale out. Good. Whole way right there. Good. All right, other side for me. Hand right here. Take deep inhale. And deep exhale. Whole way out. Good. Good. All right, flatten your back for me. All right, now with job duties on a computer all day, we've developed some really tight bicipital muscles as well as the forearm flexors. And so what we do with some of Clint's treatment is do a little muscle work, a little instrument or fascial reduction, fascial treatment on the flexor muscles to help improve the circulation down into his wrist, his forearm, and we're going to help loosen up some of the medial epicondyle muscles, the common flexor tendon it's called, that attaches right up here. And that's probably a little sore, right?
A bit, yeah.
Pull this up a little bit higher right there. So these instruments, a guy named Graston, I believe, started with what we call instrument-assisted soft tissue mobilization. And it's a really effective treatment to gradually help stretch, elongate, and reduce fibrous muscle adhesions throughout different muscle groups that we work on. And so for Clint today, we're working on the front chain line or the front arm muscles, the flexor muscles that curl the elbows and curl the fingers. Straighten your elbow for me. Perfect. Roll your left shoulder open. Correct. And this is going to gradually help as we do this a couple sessions to reduce some of the tightness that we feel, kind of like right throughout here, fellas. So now the other thing that's going to help you is some of the wrist stretches, the finger stretches, and the palm stretches on the wall.
Mm-hmm.
And we'll demo that right after we're done here. After we do a little instrument work, we're just going to do a couple passes with our hands right up through the bicep. And he can feel different areas, like feel that thing right in there.
Yeah.
And he feels all these little bumps in his muscle, which are just fibrous adhesions, little sticky spots in the soft tissue that develop. Good. All right. We're going to do this on the right arm as well. first, let's just relax the hands. And thumb, good. And then just a little stretch with the elbow today. Bend into my hand, so let's pull your wrist up. Pull. Through your elbow more though, like that, correct? And now relax for me. And so guys, we're gonna work on gaining full extension back into the arm. Pull. And stop. Or better extension down into the elbow. Bend. So he's gonna pull into flexion and then relax. We're gonna block his elbow with the knee. How's that feel? Tight, huh?
It's tight.
Pull and stop. One more pull and stop. All right, good work, man. All right. Right off the get-go, we can see how you can kind of almost move this elbow into full extension. There should be a little less tension, a little less pain in the elbow, a little less soreness in some of the muscles. Very common right around here, around the elbow crease and the common flexor tendon, where we get an accumulation of just chronic muscle tightness, muscle spasm, muscle irritation, which ultimately will decrease his range of motion in his elbow, his wrist, his fingers, and up into his shoulder. The arms are linked to that forward rounded posture, so we want to work on shoulders back and down, as well as get him educated on some forearm and wrist stretches, paired with treatments. All right, good work. You guys can see how red this area gets. We're just using a light force through this is the rock tape blade or the rock blade, and rock tape makes this tool, but it helps to loosen up the fascia, the connective tissue, and the musculature. Hold right there for me. And just like we did on the left arm, open up, bend the elbow, and stop. Bend the elbow, and stop. And bend the elbow, and stop. One more bend, and stop. Good work. All right, back down. Okay, tight, huh?
Yeah, a little bit.
Good. Now let me pull this elbow just a little bit. All right, good work. Okay, both hands right here on your thighs. Reach fingers down towards your toes, right there. Shoulders open a little bit. One of the things we want Clint to do at home in bed, hand press on thigh, and then let's work on straightening the elbows long and roll the shoulders down and open. So when you lay in bed at night, Clint, I want you to put your hands on your thighs. You're gonna try to push your right hand into your right thigh. As you do that, you're gonna pull the right shoulder blade back and open. Keep that hand right there. There you go, like that. And now left hand up a little higher, push the left hand down, and let's pull the left shoulder blade back. You probably will feel, I think the left side is a little bit tougher than the right side.
Yeah.
Can you feel how the scapula kind of pull back into the table a little bit? So
Slightly uneven.
feel how uneven you are?
Yeah.
Okay. So we want to work in bed at developing nice square, nice straight spine posture. We pin the hands to the thighs, we straighten the elbows a little longer, and then we're going to roll the shoulders open. And you're going to lay in bed at night, keep all 5 fingers on each hand pressed down. We're going to work on right hand push, right shoulder rolls open for 5 to 10. And then left hand push, left shoulder pulls back. And you can go side to side, right side, and then left side. It's a real simple way to teach the brain how to coil or twist up into the spine a little bit. Okay. All right, let's do neck now, and then we are good today, right there. All right, little turn to the right. Relax this leg. Good. Good. And one more here on the right shoulder. Good. Okay, buddy. Let's put right hand up on the left shoulder, like that. And then here. And then for Clint, we're going to do a anterior spinal adjustment. Take deep breath in. Exhale out for me. Whole way down. Good. Breath in. Exhale out. Whole way back. All right. One more in. Exhale out. Whole way down. Good. All right, spin over here to the right side for me. Shoulders open now. Perfect. Head up high. So we want Clint to just lean back into his hands a little bit throughout the day. Roll the shoulders open. Feel the back muscles engage. Much better through the triceps now. Much softer through the neck. Stand up tall for me. Last thing I want Clint to start working on, and you're going to face me this way. Open the right hand up. Plant the hand on the wall. Try to flatten and spread each of the fingers. And hold right there. Gently straighten the elbow. Just walk your feet, turn your feet just a little bit, Clint, this way. And try to lean and pull your head away from the right arm. Can you feel how that stretches down into the elbow, the shoulder, and the neck? All right, you're gonna hold this for about 20 or 30 seconds. If we can, we're gonna turn a little further away. But if we're good right where we're at, you're just gonna kind of stay right there, okay? Slight gap. So as we work on Clint's arm, we're stretching the front chain, the bicep, the forearm flexors. He's gonna try to flatten all 5 fingers gently down to the,
That was good.
not there yet, right? All right, spin around, let's do the other side. Left hand opens up. Head up high. Pull the head away from the right shoulder. And Clint's gonna work on this left elbow straightening. Maybe turning the feet a little further. And starting to open up this left side shoulder. And super tight up through the pec, super tight through the bicep. But we're getting a nice forearm flexor stretch. As he leans his head away, it's gonna also help to reduce neck tension and compression up in the cervical spine and stretch the right side of the arm. All right, buddy? Cool. Good appointment today. Thank you. Thank you.